Hello and welcome to my channel. My name is Peter Abraham. I am a registered nurse with experience in cardiology, med-surg, long-term care with rehab, and hospice and palliative care, with the latter being where most of my experience lays. If you're new to this channel, welcome and thank you for visiting. If you like what you're seeing, please like. If you have any questions about what's being covered today or what you'd like to see down the road, questions about being a nurse or a hospice nurse, holistic nurse, chronic illnesses, disease, terminal illness, end of life, please comment. This is a non-judgmental channel. And subscribe if you like to see more. So in today's episode, one of my viewers, Linda Gale 4277, asked for an episode to discuss end-of-life doulas. So we'll be doing that in today's episode discussion. I do like to start off every episode with going over areas that I'm grateful for from the last time I published. I do encourage all of my viewers, please, if you want to build resilience, resilience is that ability to just snap back after a storm in your life. Look for areas for which you are grateful. So even when you're being hit in the middle of a storm, and that's the hardest time to look, when you're being pelted with hail and sleet and freezing rain and you're outside and getting soaking wet and you're just frigid, it is very hard to find anything to be grateful for, but as you are able, look for those small glimmers of hope, that silver lining, because when we hold on to that which is positive, that which is good, that builds up that resilience so that when the next storm in life hits, and they usually do hit, you're not pelted as bad. Your skin is thicker. You're more resilient. And when I say thicker skin, I'm not referring to becoming jaded, but just being able to tolerate that storm just a little bit more, even if it's just a little. So looking at areas of grateful, I did publish on Monday, mainly because I completed the 18th book, the second in a series looking at the Hope Tool. So Medicare, after many years of having the hospice item set, commonly referred to as HIS, the hospice item set in years to collect data, is moving to the Hope Tool that must be in place October 1st of this year. And I already had published back in October of last year, Hope in Practice. This is about implementing hope. And in this book, it does go over the necessity to train staff on the different assessment types, because there's an admission assessment. There's 2 update assessments to have to take place. There's special focus visits and there's discharge visits. And so I just finished publishing the book Hope in Action that goes over those assessments. I don't have the author coming yet. That should be coming the 3rd week of March. When I publish, I'll order author copies a day or 2 after the paperback is released, and it typically takes Amazon anywhere from 2 to 3 weeks to ship. And I don't belong to Prime, but even if I was Prime, it still take 2 to 3 weeks. So I'm grateful, and I'm also grateful. Normally, when I publish, sometimes I'm a newbie publisher. I'm not Stephen King, and I'm not Barbara Carnes and other people that have well-known names. So I'm thrilled if it takes, somebody buys my book within 30 to 60 days, but already 1 ebook sold and 1 paperback sold of Hope in Action. So I'm grateful for that. I'm also grateful I was on and off with writing a book. I'm still in process for what I'm about to talk about, but I wrote a book, Motivational Interviewing. Oh, my word is towards the bottom of my pile. Motivational interviewing for nurses, as part of my holistic series that deals with compassionate, tongue-tied here, dealing with compassion and conflict, how to provide care when you're in conflict situation. That comes in extremely handy with dementia patients or anyone going through psychosis, as well as dementia staging mastery. So in October, around the same time I decided to throw my energy into writing this and getting this published, I had started a book, Cognitive Behavioral Therapy, CBT, in nursing, to be part of the Holistic series. So I picked up going back to writing that book. It's taking much longer. Even though we use APA formatting when I went for my BSN, and almost every research paper that we have to write, I shouldn't say almost every research paper we have to write, has to be APA formatting. And just I'm going to jump ahead a little bit to today's episode. We're going to be discussing about doulas. But like when I did my research for what I'm going to talk about today, this is APA formatting in terms of the reference sheet. So almost everything is APA, and that takes longer when you're writing in that style. A lot of my books are not written with APA format. There's pros and cons to that. I know those who are used to the APA would, bad Peter. But to me, if I want to get the information out there, and I do have references in all my books, I'll skip the APA to save time. But for certain books like Cognitive Behavioral Therapy that has a lot of science behind it, I know for a lot of my readers, in order to even consider purchasing it, they're going to want to know, is it APA formatting? It is. Oh, it is extensive. And so it's taken a lot of time. So I'm grateful that I now am back into writing that book. I'm hoping to publish that either later this week or earlier next week. It has been rather intense. I put in a lot of hours to these. So yesterday I was up till almost midnight with writing. If you're working for somebody and doing this for somebody else, you're looking at an 8-hour shift. You're looking at your breaks, and you have 15-minute breaks every 4 hours. You're getting 2 15-minute breaks. You're looking for a 30-minute lunch. And you're trying to call it a day at the end of your shift, wherever that may be. But when you're self-employed and you really want to push through, you forget what time it is. Anyway, before I go down too many rabbit trails, I'm grateful for being able to write that book. I'm grateful, one last thing, I've been really struggling with this, and I don't know if I've shared this in any other episodes. As much as I talk about trying to find those silver linings and being grateful, sometimes that's a struggle. I'll be very honest with you, that can be a struggle. I've been dealing with a lot of on and off sadness, not depression, but on and off sadness since we moved to Kentucky, because I miss being out there in the field. I was in an interesting predicament in Pennsylvania when I got suddenly let go June 14th. That was in episode number 1. Ageism, am I unvaccinated? Or is it because I advocated too strongly for my lung cancer patient who wanted palliative sedation? But because I knew we were going to go to Kentucky, I was only looking for remote work. And yes, for Marie preppers, if you're watching this, I am considering your courses. I just want to be able to give 100%. So I am struggling on and off about missing being out there in the field. I have continued to apply to different places, both locally and remotely, but I still struggle with that. And yesterday I'm taking our puppies on a walk. Bonnie's there behind me, Penny's somewhere else in the house. And I'm just thinking, God, just help me be content. God has me in the place of authorship and writing books. And that's going beyond measure. We're already above 200 books sold in March. And I don't know if we'll be like February, which was 595. But I'm grateful for every one of you reading my books and writing. So I'm just going through that challenge of like, this is where God wants me to be. Just be happy with it. So I'm working through that. So moving on, you see I'm prone for rabbit trails. So moving on to end-of-life doulas. So thank you, Linda Gale, for asking about this. This is something I've actually been looking at for a year to a year and a half. Even before June of last year, I was considering with hospice. I love hospice, but full time is often 45 hours at a minimum. If you're case managing, I still remember Grain Hospice, I was averaging 50 hours a week. So I'd have weeks at 70, 80. I'd have weeks that were 40, which was rare. And I did take vacation, and that's 40 hours of vacation, and still averaged 50 hours. I kept the spreadsheet. Wonderful for the overtime because they paid hourly. But oh boy, you can't. Anyway, don't want to go down that rabbit trail. But I was looking at doulas. So what is fascinating about the doula program? If you ask yourself the question, I wonder if there is a professional that is holistic. So holistic means the whole, mind, body, spirit, soul. What if there was a holistic professional that bridged the gap for practical end-of-life care? See, one of the caveats for being a palliative and end-of-life care in hospice is I was rarely there when my patients took their last breath. I think in 2022 was my best year. I was present for 8 deaths in 2022. Every year was a little bit different. Some years, I think 2024 was maybe 2 or 3. So every year is different. If I'm visiting and they look like they're going to pass, I'll stay. And I've had cases, I still remember the place that was in the southern end of Glen Rock, Pennsylvania, where I actually had to drive a half a mile into Maryland. It was rural, and come back up an old country road into southern Glen Rock, Pennsylvania, where I was with the family for close to 4 hours. I was lightly chastised by the hospice agency that I should not have been there that long. But I want to be there. Part of my heart is to be there for the family through thick and thin. And so what if there is such a profession that does that? That's your end-of-life doula. That is your end-of-life doula. So if you think of like a birthing doula, more and more people are aware of what is your birthing doula, people having births at home. They'll have a birthing mother. Oh my word, I can't think of the other name for that. That's actually in the Bible, and it's talked about in Exodus, and oh my word, I don't remember. But end-of-life doulas is on the opposite end of the spectrum. And ever since COVID, they're just blooming. And one of the persons out there that is more well known than a lot of the others out there. So we talk about hospice. Hospice nurse Julie's well known in the YouTube and Instagram and TikTok era, and she's a wonderful nurse. There's hospice nurse Penny. There's Barbara Carnes, who gone from my site. Shelley Henry I mentioned in the other last episode or two from the Amity group. I believe over time, and I'm not trying to gain fame, but I think over time I'll become more known because I'm one of the few authors that have 18 books published specifically for hospice nurses. But Kacie, Kacie, I apologize. I don't want to mispronounce your name. I'm not going to try with your last name. But Kacie was recently featured in People magazine, and I will link in the description down below the article from People about Kacie. But Kacie was a nurse. Now, I don't know if, Kacie, you're going to comment and say you were 12 years in nursing versus 11, but just looking at your LinkedIn profile, left being a registered nurse in 2011. Became a registered nurse in 2011, left in October of 2022 to become a death doula, and has grown in that field and is still a death doula, and actually started the Death Doula School in March of 24. And so she's extremely well known, well versed in this field. And so when we talk about what is death doula, and I am going to be referring to notes more so than my previous episodes, because this is not an episode where I can say I'm in it. So I'm in hospice. I could talk about a lot of things without going back to notes, but I want to do this justice for Linda and other people who are interested in this. So in terms of the core definition of a death doula, and this is from the International INELDA core definition, non-medical professionals. Kacie's one of the exceptions, being an RN. If I became a doula, I'd be another exception as well. But non-medical professionals offering emotional, spiritual, and practical support to dying individuals and families. So part of the problem I have, my bad, when I go on rabbit trails, I have to remember where I left. So I talked about the 1 year I was the most there for the deaths was 8 times. Well, a lot of the death doulas, they'll do vigil. And a lot of the death doulas, let's talk about non-vigil. So you have vigil is, they can go at any moment. We don't know how much longer. And so the death doula will be there in person with family, friends, or sometimes they're the only one there if family and friends can't make it. And they'll be there for the entire journey until that patient takes their last breath. They'll be in coordination with hospice and palliative care, the family, and they'll be there through the end. But there's also other occasions. So I still remember vividly a case that I had while working with Grain Hospice, where dying under most circumstances is not painful, especially if they do need medications, and those medications are given in a prompt and scheduled manner. But there are facilities out there where short staffing, providers just, it is an outright mess. I cannot emphasize it enough. It is better to die in a home setting than in any facility. There might be fine print for a hospice inpatient facility, but home's best, because you or somebody that you've hired is going to be more diligent. And I'm not saying that the people out in facilities don't care, but sometimes they're overwhelmed because of the short staffing. And when you're at a facility, you need the facility doctor to approve and sign off. The bureaucracy is beyond, it's frustrating. So I still remember this patient who had extreme terminal restlessness, and the facility staff was acting as fast as they could, but the doctor was delayed in getting the orders through. And we have to obey the law. More so in the home facility setting. Like in the home setting, we still have to obey the law, but I'll be the first to, I'm gonna give something and call the doctor. I need an order because I did it and I'm asking for permission after the fact. And I know when I call, I'm going to get that permission. You've been a hospice nurse for as long as I have. You know what the proper boundaries are, and there are things you can stretch. But in a facility, you can't go there. You have to, you're tight. And so the daughter was there. And I went and I stayed as long as I could. Now, thankfully, our chaplain was there for hours. But not every hospice agency has somebody that can go there and spend that amount of time. But end-of-life death doulas can fill so many gaps that hospice and palliative care providers cannot. Well, they're not a medical professional. What are they going to do? Well, in this case, for this individual, they kept trying to get out of bed to go to the bathroom, and they didn't have to go. This was restlessness. And I'm not saying they didn't ever have to go through that at the time, but if they just went and they were just held back, they don't have to go 2 minutes later. So as a non-medical professional, you can stay, and I'm using aliases. Now, John, stay in bed, or you can ring the call bell if it gets to be, too much. You can be reassuring. You can play instrumental music. You could talk in a very calm, relaxing voice. You could use validation therapy, which is a non-medical technique. There's many things that you can do. So in terms of the roles of the death doula, so we talked, they create emotional care. They facilitate addressing the fears of dying. They create a space for just being vulnerable. And in this article about Kacie in People magazine, it talks about how Kacie asks a lot of difficult questions that do need to be asked. But you could ask that in a compassionate, loving way to just get out, like, what are you afraid of? Tell me, what are your thoughts about death and dying? Whether it's to the patient or family members. But Kacie and others that are out there, they'll do end-of-life planning. That's your advanced directives, your living will, the 5 wishes, the POLST, Physician's Order for Life-Sustaining Treatment, in some locations MOLST. But they'll work through that paperwork to get all the plans in place. So they'll make sure that paperwork is communicated to the appropriate parties. And they'll become an advocate with and for you and your loved one. They'll also provide that emotional support. Dying is not painful, but for many, and I know Rebecca, if you're watching my videos, Rebecca is a loving daughter for her dad, who happens to be in hospice services up in New York. And Rebecca and I have been having a lot of communication going back and forth, where it's a struggle for the families. We're a struggle for Rebecca, her brother Dan, and her aunt and family members. And I'm not doing this as a death doula. You could argue I'm being a death doula now, unpaid, but I've been trying to and doing emotional support there. And Kacie and the other death doulas are doing emotional support. Like Rebecca, and hopefully you don't mind me sharing this piece, but like sharing the fears. Like I'm having trouble going as often as I'm going. What are you afraid of? Well, what if he passes before my eyes? And those are very valid concerns and valid fears. So when somebody expresses emotions to you, always validate their feelings. Always validate their feelings. That's the kind and thoughtful and gentle thing to do. And don't validate by saying, I've been there. Because even if you were close, you're not in their specific shoes. So be careful how you validate, but validate their feelings. Explore their feelings. What are you afraid of? Tell me about it. And walk through the reality of it. So in this specific case, the reality was, did the hospice or the facility say your dad is transitioning or actively dying? No. Well, if they're not actively dying, the chance of them actively passing right before your eyes is very low. Now, I'm not God. I can't say it will never happen. Anything is possible, but it's very low. And if they're not transitioning, it's also low. Could they start transitioning with your visit? Yes. But so far, there's been no evidence that he's approaching that yet. So we go over what are the realities of this. And then, well, I'm afraid, what if he's in pain because he's not verbal? And so I shared an article about how you could visually, like, is there a furrow here, wrinkling of the eyes? Is there moaning, groaning? There's things that family members can look at. And this is stuff that death doulas can do, because you don't have to be a medical professional to say they look like they're in pain. So they're providing that emotional support and also spiritual guidance. I still remember a case I had in 2023. It was my first time working with a death doula. It was in, I did so much rural, so most of my experience is rural. It was in the Wrightsville area of Pennsylvania, Crayley Road. You had to be very careful, like even to find the opening in the road to go up a curvy hill, wondering if you're ever going to get to the house. Oops, wrong house. Oh my word, sorry. But similar area. And, but she was like, with this particular family, it was very important to have the windows open. So when they believe that when the patient dies, the spirit has to go out the window versus staying in. And now I personally don't believe that. But when we talk about being there for somebody else, we're not there to impose what we believe. So, and for those of you who've been watching, you may have seen in other episodes that I've confessed my faith in Christ Jesus as my Lord, Savior, and King. That has not and will not change. But when I'm with somebody, if I have the opportunity, if they open the door for me to share the gospel, I will share. But if they do not open the door, I need to respect their beliefs. I wish we lived in a world of fine print, so I do have to disclose, and maybe this excludes me from certain areas, and I'm fine with that. If it was part of their belief to support them in doing something that was so heinous to Christ, I would have to excuse myself, and I say, I'm not that person. Let me help you find somebody for you, but I can't be that person. That has to be my fine print for my boundaries. But if it's something like with this family where that doesn't go against anything in from a biblical perspective, and I didn't say that to them, that's in my head, I could support that person. And I can support that death doula who is there to support the family. But they'll do the spiritual guidance with the family's belief system. And there are death doulas out there that will either work with the funeral home or because of the laws not being extremely clear, will prepare the body for the funeral home. And we're not talking embalming or doing anything of that nature, but we'll do preparation. But they serve a lot of roles. And they are unbelievably valuable because there's so many gaps with hospice and palliative care. I cannot share with you, and hospice nurse Julie actually did a video about this a few weeks ago, where hospice families, home hospice families are so disappointed with hospice. Is it hospice's fault? No, it's not. I have a book. Oh my word. Understanding Your Rights Under Hospice Care. This goes over what you're supposed to be getting, how to find a good hospice provider, and so on. So Medicare, regardless of what your insurance for you're using under hospice and palliative care, Medicare governs hospice. The hospice side. If you're a palliative care, maybe not, but hospice, yes. And according to Medicare guidelines, hospice is never the primary caregiver, I should say fine print. Continuous care, inpatient care in a hospice facility, they're the primary caregiver. But even in a hospital setting, they're not the primary caregiver. In the home setting, the family. So if I had a family member on hospice and they were here, I would be the primary caregiver, not hospice. So at 1 a.m. in the morning, if my loved one on hospice needed medication, I would have to be the one giving it or paying somebody to give it. or having a friend give it. So in a 24-hour day, hospice might be there let me show you the best case scenario that I've been involved in, and I've been blessed for some of the agencies I've worked with, where they were very forgiving for staff in focusing on real patient-centered care. But I remember my case, I'm sorry, I have to bring out the smiles. Ernie, a stout German woman who was living with her daughter. Oh my word, I can't remember the township, but she was living with her daughter, and her daughter, like a lot of individuals, are working long hours and had to work. And how can we care for Ernie when her daughter's gone for like 8 to 12 hours? And so I still remember myself and Nikki and others, like we would have our visits staggered. So Paige, a social worker, Nikki, our CNA, myself, I'd come and spend an hour, and then Nikki would come and spend an hour, and Paige would come and spend an hour. Now, granted, that's 3 hours, and what about the other, 5 to 7? But we would stagger our time. They weren't back to back. But that way, there was a level of coverage, but we weren't able to be there for that many hours. And as I talk about doulas, so if you're considering being a doula, I'm not confining you, or I don't know what Kacie arranges for the hours, and other doulas out there arrange for the hours that they work, but they're there more often, so that they're far able to do more. In terms of the history, in terms of recognition in the U.S., it's mainly from the 1990s. But when I look back historically, they were around in medieval times. So death doulas have been around for a while. And again, they've been growing tremendously since COVID. I did do an article, which I'll include in the links below, last year about the explosion of death doulas. In terms of like, how do you become one? And this is something I've been researching as well. This is a finicky area. If you want to become a CNA, we'll start there. Certified nursing assistant. In the United States, it's a nationally recognized certification. So you would find a community college, or a lot of the nursing homes will run classes. You take classes and you go take a certification exam. And on this one, I don't know if it's limited to the state. I apologize for that fine print. But registered nurse, licensed practical nurse. You go take the NCLEX, the nursing boards, and you're good. And like, I got my nursing license in Pennsylvania. It's back there. My Kentucky one I didn't hang up yet. But I achieved that, and I'm licensed. So I moved to Kentucky late last year, and I go to get endorsed. And I don't have to retake my boards again. I do have to get, the state and local background checks, and I had to do, jurisprudence exam to prove I understand the nursing practice scopes within Kentucky. But it was a rather simple procedure, and some of my nurse colleagues, they have licenses in close to, if not all, 50 states. So it's nationally recognized. And if you go to a nationally recognized school, I went to Harrisburg Area Community College, there's a national recognition. But for end-of-life doulas, at this time, this is March 12th, 2025, there's no certification program that it's a national program. There are institutions that are gaining in recognition. So most well-known organization is the INELDA. And I apologize because I really should have spelled out what the initials are. And even in my references, I did not. But that's the, oh my word. Please forgive me. Remember, these are recorded but live videos. So there's the National End-of-Life Doula Alliance, NEDA, the International End-of-Life Association, the International Doula Life Movement. So these are organizations that are vying with one another as to who's going to be the leader. Kacie also has her own school. But there's different certification programs. The INELDA recommends hospice volunteering and counseling experience, but Davis, etc., has like no formal education is required. I'll include the APA references below. In terms of certification programs, there's the INELDA, which is a 24 hours of training and 1 year membership. There's the NEDA proficiency badge, which requires an ethics exam. That's the National End-of-Life Doula Alliance. But one of the criticisms, this is back from 2021 with Thompson, but this is still true in 2025. There's no lack of standardized clinical hours. So when I took my nursing boards, and I do not have this memorized because I took my boards in January of 2017, you have to have so many clinical hours in registered nursing, and not, I shouldn't say it that way, in registered nurse school, in nursing school, when I went for my associate degree, I needed so many clinical hours before I could take my boards. Didn't matter that I passed. Didn't matter what my GPA was. If I didn't have the clinical hours, I couldn't take the NCLEX. There's no standardization for what encompasses doula training and being out there in the field and having a mentor, a preceptor. There's no standardization. So there is a certificate debate. There's pros if you are certified with any of the existing certifying bodies. That again, there's not national recognition of which one is recognized. They're gaining recognition. But the pros are it builds credibilities with the families, and if you go to partner with hospices, hey, I'm a certified end-of-life doula. The cons, and to me this weighs heavily. I'm not saying it has to weigh heavily on you, but it weighs heavily on me. But the cons is there's no oversight, and in my opinion, experience matters more than the certificates. So there are benefits, though, for going to these different schools that are offered. Most of those benefits are they include a lot of business development. So a lot of the programs out there will help you in how to build your own end-of-life doula business. So part of the fine print out there, which we lived in the world of no fine print, if you become an end-of-life doula for right now, as of today, you are self-employed. You are self-employed. As a hospice nurse, I desire to go work for a hospice agency. So even if I was working for a staffing agency, I'd be working for somebody above me. For an end-of-life doula, you are working for yourself, and you're making your own connections to get work. Now, you might do this by joining the local business bureau. You might go just doing networking, Facebooking, Instagram, LinkedIn, and so on. But you're building your own business. So a lot of the schools and programs out there that help you become a death doula have programs as to how to build and market yourself. So they'll go over how to use Canva, Canva.com, and other tools like Kittle to build marketing literature, how to build a resume, how to build your LinkedIn profile, how to do a cover letter, how to present yourself. They have tools. And a lot of them have training as to, for those of you who have never helped somebody fill out a physician's order for life-sustaining treatment, they'll walk you through how to do that. A lot of these programs, and this is part of my dilemma, are in person for a portion of their programs. And in person is in certain states. So some states have more in person, like in Kentucky, not much for right now. And even in Pennsylvania, when I lived in Pennsylvania, not much there. But certain states are more prolific in like something on site that you could actually travel to within a couple hours of driving. But other programs, unless you're flying and staying overnight, they do have, a lot of them do have webinars. Most of the webinars are in the latter part of the evenings, because most of them running their schools, like Kacie, are working full time. So I don't blame them for running their program in the evening. I'm not saying that's when Kacie is, but I know for the International End of Life Association, that's one I've been looking. I'm not saying that's what I'm going to be going with, because I have been seeing more of the NEDA. I don't know, because it's not, to me, it's not a popularity contest. For me, part of the dilemma is I am a registered nurse, so I already know what death looks like. I already ran my own business for 18 years, Dynamic Net Inc., so I already know the business end of the fence, and I'm publishing books, so I have I don't have a need for that. I have a need for some of the other areas, more so with paperwork for the different states that maybe I've not dealt with. Like I've not dealt with the Kentucky, but I may end up researching that myself, but I want to go on that rabbit trail. But in terms of the resources, I'm watching the time. I'm going to put those in the description down below. But if you're interested in death doulas, and thank you again, Linda Gale, for asking about this video, please pursue it. There's groups on Facebook, there's groups on Instagram, and I don't know if Instagram has groups, I should say LinkedIn. I know Kacie and others are strongly promoting this industry that is growing. And one day down the road, there may be an organization that will hire death doulas. And hospice agencies do, by the way. One of the leading members of the International End of Life Association actually works with a hospice agency. She's actually a hospice agency employee. So you could actually be hired by hospice agencies. So there's a lot of potential here. And even if you're not going to be doing it from a paid perspective, there's so much value that you could be adding to this. So what about next step? So we're going to end here, ending in hopefully less than 5 minutes. If you're interested in this, again, I'm going to be putting a lot of resources in the description below. But if you're interested in this, look for the Facebook groups. I'll do my best to put at least one in the link below, the description below. Facebook groups, LinkedIn. At this point in time, I can't recommend books on the subject matter. If I'm sure Kacie and others will have book recommendations. Become a hospice volunteer. Most hospices are struggling because they require 5%, and in Texas it's 10% of volunteer hours. So become a hospice volunteer. That is wonderful experience for you. And you're giving back to a local community. You're learning, and that can go on your resume. That could be part of your toolkit. When I'm a death doula, I was a hospice companion volunteer for X amount of time. Become a hospice companion volunteer, hospice volunteer, and don't be afraid. You are beautiful and wonderfully made. You matter, and you can make a wonderful difference in the lives of those around you. Thank you for watching. If you like, subscribe, comment. God bless and goodbye.